Aortic valve stenosis. Aortic valve stenosis, or aortic stenosis, happens when the heart's aortic valve limits. The valve doesn't open completely, which decreases or squares bloodstream from your heart into the primary conduit to your body, aorta, and to the remainder of your body. Your treatment relies upon the seriousness of your condition. You may require a medical procedure to fix or supplant the valve. Without treatment, serious aortic valve stenosis can prompt passing. Side effects. Aortic valve stenosis goes from gentle to extreme. Signs and indications for the most part happen when narrowing of the valve is serious. A few group with aortic valve stenosis might not have manifestations for a long time. Signs and side effects of aortic valve stenosis may include strange heart sound, heart mumble, heard through a stethoscope, chest torment, angina, or snugness with action, feeling weak or dazed or swooning with movement, windedness, particularly when you have been dynamic, weakness, particularly during seasons of expanded movement, fast, shuddering heartbeat, palpitations, not eating enough, primarily in kids with aortic valve stenosis, not putting on sufficient weight, primarily in kids with aortic valve stenosis. Aortic valve stenosis may prompt cardiovascular breakdown. Cardiovascular breakdown signs and manifestations incorporate exhaustion, windedness, and swollen lower legs and feet. When to see a specialist. On the off chance that you have a heart mumble, your PCP may suggest that you visit a specialist prepared in infections of the heart, cardiologist. On the off chance that you foster any indications that may propose aortic valve stenosis, see your PCP. Causes. Your heart has 4 valves that keep blood streaming the right way. These valves incorporate the mitral valve, tricuspid valve, pneumonic valve and aortic valve. Every valve has folds, cusps or flyers, that open and close once during every heartbeat. In some cases, the valves don't open or close appropriately. On the off chance that a valve doesn't completely open or close, bloodstream is decreased or obstructed. In aortic valve stenosis, the aortic valve between the lower left heart chamber, left ventricle, and the aorta doesn't open totally. The region through which blood moves out of the heart to the aorta is limited, stenosis. At the point when the aortic valve opening is limited, your heart should work more enthusiastically to siphon sufficient blood into the aorta and to the remainder of your body. The additional work of the heart can make the left ventricle thicken and augment. In the end, the strain can cause a debilitated heart muscle and can at last prompt cardiovascular breakdown and other significant issues. Aortic valve stenosis causes include inherent heart deformity. A few youngsters are brought into the world with an aortic valve that has just 2 cusps, bicuspid aortic valve, rather than 3, tricuspid aortic valve. Once in a while, an aortic valve may have 1, unicuspid, or 4, quadricuspid, cusps. Having an inherent heart deformity, for example, a bicuspid aortic valve requires customary tests by a specialist. The valve imperfection may not bring on any issues until adulthood. In the event that the valve starts to restrict it or spill, it should be fixed or supplanted. Calcium development on the valve. Calcium is a mineral found in your blood. As blood more than once streams over the aortic valve, calcium stores can develop on the heart valves, aortic valve calcification. The calcium stores may never create any issues. Aortic valve stenosis that is identified with expanding age and calcium store development ordinarily doesn't cause indications until ages 70 or 80. In any case, in certain individuals, especially those with an intrinsic aortic valve imperfection, calcium stores bring about solidifying of the valve cusps at a more youthful age. Heart valve calcium stores aren't connected to taking calcium tablets or drinking calcium-sustained items. Rheumatic fever. This complexity of strep throat contamination may bring about scar tissue shaping on the aortic valve. Scar tissue can limit the aortic valve opening or make an unpleasant surface on which calcium stores can gather. Rheumatic fever may harm more than one heart valve, and in more than one way. While rheumatic fever is uncommon in the United States, some more seasoned grown-ups had rheumatic fever as kids. Risk factors. Hazard variables of aortic valve stenosis include more seasoned age. Certain heart conditions present upon entering the world, inherent coronary illness, like a bicuspid aortic valve. History of contaminations that can influence the heart. Having cardiovascular danger factors, like diabetes, elevated cholesterol and hypertension. Ongoing kidney sickness. History of radiation treatment to the chest. Entanglements. Aortic valve stenosis can cause complexities, including cardiovascular breakdown, stroke, blood clusters, dying, heartbeat issues, arrhythmias, diseases that influence the heart, like endocarditis, passing, counteraction. Some potential approaches to forestall aortic valve stenosis include finding ways to forestall rheumatic fever. You can do this by ensuring that you see your primary care physician when you have an irritated throat. Untreated strep throat can form into rheumatic fever. Luckily, strep throat can for the most part be effectively treated with antimicrobials. Rheumatic fever is more normal in kids and youthful grown-ups. Tending to chance components for coronary vein sickness. These incorporate hypertension, stoutness and elevated cholesterol levels. These variables might be connected to aortic valve stenosis, so it's a smart thought to keep your weight, pulse and cholesterol levels leveled out in the event that you have aortic valve stenosis. Dealing with your teeth and gums. There might be a connection between contaminated gums, gum disease, and tainted heart tissue, endocarditis. Irritation of heart tissue brought about by contamination can limit conduits and exacerbate aortic valve stenosis. When you realize that you have aortic valve stenosis, your primary care physician may prescribe that you limit arduous action to try not to exhaust your heart.